We would now like to go ahead and transition to our next presentation on the importance of understanding your lymphoma subtype, and Dr. Reiman will be joining us again to present on this session. So for those that are just joining now for this session, many of you will probably likely have been coming from previous sessions, but I'd just like to provide a very brief introduction for those joining us. My name is Caitlin Bafis-Lasky. I'm the Manager of Patient Programs, Research and Advocacy at Lymphoma Canada, and I will be the moderator for today. I would also like to introduce our presenter, Dr. Tony Reiman, who is also the chair for our national conference this year. Dr. Reiman is a practicing medical oncologist at the St. John Regional Hospital in New Brunswick, as well as the Assistant Dean of Research at Dalhousie Medicine in New Brunswick. He works primarily with lymphoma, multiple myeloma, and lung cancer patients. I'm pleased to welcome you all to our next educational session, which will focus on educating about the many lymphoma subtypes and why it's so important to know information about your lymphoma subtype, especially for those who are newly diagnosed or even those who have been within their treatment journey but don't know their specific subtype. This session, as I may have mentioned previously, is being recorded, and the recording will be available following the conference, and you will receive an email at that time that the recording does become available. At the end of this short presentation, we'll try to leave a couple minutes for a question and answer period. If you would like to ask a question, please type it into the questions box, which is located in the middle of the black toolbar at the bottom of your screen. Thank you so much for joining us today, Dr. Reiman. I'd now like to turn over the presentation to you.
Thanks again, Caitlin, and welcome to those of you who are just joining. We're just going to take a few minutes to talk about the importance of knowing what kind of lymphoma you have. So sometimes it feels like, okay, I know I have lymphoma, great, now we're all set. But it turns out that that isn't the end of the story when it comes to making a lymphoma diagnosis. So we'll briefly touch on what kinds of lymphoma are there and why does this matter in the next 10 minutes or so. Well, I don't have a prayer of trying to tell you about all the different kinds of lymphoma. There are over 80 different kinds, according to the current classification scheme that we use. And inevitably, we will see this number increase as we discover that there are actually more types than even we realize now in 2021. And there are different ways to try to categorize these. We talk about Hodgkin lymphoma versus non-Hodgkin lymphoma. And then, of course, there are different kinds of Hodgkin and non-Hodgkin lymphoma. We talk about, particularly for non-Hodgkin lymphomas, the B-cell lymphomas versus the T-cell lymphomas. In the earlier session, if you were there, you would have heard that lymphomas are cancers of lymphocytes, and we have B lymphocytes and T lymphocytes that can turn into different kinds of lymphoma. And of course, there are many different kinds of B-cell lymphoma, many different kinds of T-cell lymphoma. We can talk about low-grade or indolent lymphomas, and we'll touch on this in a minute, versus the more aggressive lymphomas. So some of these are more rapidly progressive and behave more aggressively than others. And that's an important way to distinguish different types of lymphoma. But when it comes down to it, there's just a huge number of different kinds of lymphoma. And once upon a time, we realized there were this many. We didn't used to think there were 80 different types. And in 20 years, I'm sure we'll realize there are more than we realize now. So if you're a lymphoma patient or someone dealing with lymphoma in your family or someone you care about, do you need to know all the types of lymphoma? No. But I think it is helpful to know what precise type of lymphoma you're dealing with. And this really comes from the lymphoma doctor that you're talking to. They should be able to tell you this. Other members of your lymphoma healthcare team should be able to tell you this. We get that information mostly from the pathologist, the doctor in the hospital laboratory who analyzes the biopsy that we talked about in the previous session, where we obtain some lymphoma tissue to make the diagnosis. It's interesting to know that one person can have more than one type of lymphoma. There's a couple different ways that this can happen, but usually you're dealing with one type at a time. Okay, if you've got two different kinds of lymphoma, I guess you better know something about both of those and about the unique situation of having more than one kind of lymphoma and what that means. Someone on your healthcare team should be able to tell you the type of lymphoma you have, and then you can take that information and learn learn more about your specific type of lymphoma. Why should you do that? Well, Caitlin took this off my slide, but honestly, some people don't want to know a lot of details, and I touched on this earlier. Some people just are not wired that way, and they just say, look, healthcare team, just take care of me. Tell me what I need to do, where I need to be. Tell me what I really need to know to get through this, and you can worry about the details. But most people find it really helpful to know what type of lymphoma they have, and it's really particularly important if you're looking for more information about your lymphoma, or you're trying to communicate something about your lymphoma or leukemia to other people. Particularly if you start going online and looking for information. There's so many different kinds of lymphoma, and they are different, so the way things go for one type of lymphoma is not necessarily expected to be the same as the way we expect it to go for a different type of lymphoma in terms of, what is the treatment, what is the outlook, So really understanding what kind of lymphoma you have allows you to go and find information about your type of lymphoma. It's like saying, well, I have cancer, well, do you have lung cancer? Do you have breast cancer? Do you have colon cancer? Do you have lymphoma? It makes a big difference to how things are going to go. So same thing within the category of lymphoma and leukemia. What kind of lymphoma or leukemia you have makes a big difference to how things are going to go and what you need to learn. Also, through organizations like Lymphoma Canada, knowing this information can help you connect with other people that have the same particular type of lymphoma or subtype of lymphoma as you. And then you can learn specifically from them. So I've really said this, different kinds of lymphoma can behave differently or treated differently. The prognosis or the outlook is different. There are certainly similarities. We went over a lot of the things that are similar amongst different types of lymphoma and leukemia in the previous session, but there are also important differences. I'm just going to quickly illustrate a couple of those with a couple of different types of lymphoma. So one of the more common types of lymphoma is something called follicular lymphoma. So this is pretty common in Canada. This is one of those ones that we touched on in the previous talk where you don't always require treatment immediately. And sometimes people can even go on for many years without any treatment whatsoever, feeling great, looking great, living their lives fully, worried that they have lymphoma, what's going to happen, but not having to go through treatment, for extended periods of time. So that is unusual for cancer, but it's not all that unusual for certain types of lymphoma and leukemia. And it takes a while for people to get their heads around that one, I find. The other funny thing about this one is that the way it goes is not always just that the cancer grows and spreads and grows and spreads like we worry about with cancer generally. Sometimes if you have a lump of follicular lymphoma, it will shrink on its own without any treatment. This is unusual. Not a lot of cancers do this, but it's not that uncommon, again, for different types of lymphoma and leukemia to see this happen, that the disease waxes and wanes almost of its own accord without treatment. This one is different from some of the others in that you almost never find it in the brain. I mean, I can't say I've never seen it in the brain, but almost never. This one is usually not curable unless it's just confined to one area and you can zap that area with some radiation. Sometimes we think maybe that cures people. But it can be hard to tell because people can do so well without any treatment that, if they have one lump in their neck and you treat with radiation, they're still doing well 10 years later. We still don't know if it's gone or not. So although you don't always have to treat this type of lymphoma, treatment is still very helpful when needed and often works really well to put the lymphoma into a remission that can last a long time. So treatment is sometimes, often needed for follicular lymphoma. So there's an example. That contrasts with another kind of lymphoma. Here's another one called Burkitt lymphoma. This one is rare in Canada. We certainly see it, but it's just not nearly as common as follicular lymphoma. This one always requires treatment. Follicular lymphoma is an example of a low-grade or indolent lymphoma that can behave, move slowly over long periods of time. This one is a rapidly progressive type of lymphoma where time is of the essence. You need to diagnose and treat this quickly. Often people need to be admitted to hospital to get this done quickly and safely, and requires much more intensive therapy than, say, follicular lymphoma usually does in the first instance. This one has a tendency to spread to the brain, and this affects the treatment. We have to give treatment that will be directed at the brain so that we can try and make sure we never see it crop up in the brain, or if it's in there, that we can try and deal with it. But unlike follicular lymphoma, this very aggressive lymphoma, with a relatively brief course of treatment, is potentially curable. So it's really bad on the one hand that it's so aggressive initially and requires intensive therapy and can do difficult things like spread to the brain. But yet there's the potential to actually cure this one, where with follicular lymphoma, we don't usually expect to get rid of it completely. And it's a case of helping people to live with it as well and as long as they can. So there's a great contrast in just two different types of lymphoma. And there's over 80 different types. So hopefully that brief illustration just helps you to understand something about why it's important to know what subtype of lymphoma you have. As I say, how you get this information is from the biopsy and from your healthcare team. You could ask to receive a copy of the report from the lab, the so-called Pathology Report, but you'll probably want some help interpreting that. And you can get, once you know what kind of lymphoma you have, you can get really good information from Lymphoma Canada and other sources that is made for patients and loved ones to look at and try and understand what's going on. And through the course of this conference, you will have the opportunity to attend sessions that are specifically geared towards some of the types of lymphoma we see frequently and learn specifics. So I'll stop there.
Wonderful. Thank you so much, Dr. Reiman, for your excellent presentation and for telling everyone why it's so important to know your subtype. Like you mentioned, lymphoma is an umbrella term for over 80 subtypes. So, and like you illustrated as well with the two examples, there are quite big differences between the two. So it is important that you receive this information from your doctor of diagnosis. And again, like Dr. Reiman had mentioned, it helps you to plan for certain stages, to connect with others that might have a similar lymphoma subtype, and to also let your family and friends know as well. So I think we have time for just maybe one or two questions. So I'll go ahead and get started with that. The first question is it possible for me to obtain a pathology report with this type of information for my records? How would I go about requesting this? Is this something that is commonly given to patients, or do I just ask my doctor what my specific subtype is?
Well, you can certainly ask your doctor, but everyone is certainly entitled to receive a copy of a pathology report. And you may just find you could use a hand understanding the report, because it's not written in a way that's intended for patients to read. It's written with lots of jargon, shorthand, and abbreviations. So it can be tricky to wade through it, but absolutely you can get a copy for your records. And
Great. So I think we have time. Perfect. So I think we have time for just one more question. And the question is, are there still lymphoma subtypes that are being discovered, or do we sort of have an understanding of all the lymphoma subtypes that exist at this point?
Yeah, I definitely think we're going to be understanding more and more subtypes as we go along. Really, when it comes down to it, every case is almost different, it's just that, when you see recurring patterns that help you group people together and say, okay, this group of people should be managed in a certain way, or there's a certain thing we need to expect, that's when it's helpful. And I don't know how to stop sharing. So as the tools of science allow us to dissect the different kinds of lymphoma better, I think we're going to have more types to deal with as we go along.
Great. Wonderful. Thank you so much. So I just want to go ahead and thank Dr. Reiman for taking the time to share your expertise and guidance with us, both on the previous presentation and on this presentation on the importance of understanding your lymphoma subtype and how to obtain this information. This actually transitions very nicely to our next session, which is our breakout session on lymphoma subtype biology and treatments. We actually have 8 presentations from specialists from across the country providing valuable background information about the biology of the lymphoma subtype, as well as the specific procedures and tests involved in diagnosis. These sessions will importantly highlight the Canadian-specific treatment options in both the frontline and relapsed refractory settings, and also highlight research on newer therapies undergoing clinical trial testing. As a final thank you, we greatly appreciate your time and expertise on these topics, Dr. Reiman. Thank you so much for everyone for joining.